Hi, I'm Hillary Epps. I am a MSN student at Auburn University, and today I'm going to be talking about the global pandemic that we are in, COVID-19. I'm going to talk about how the pandemic affects healthcare systems, but more important, I'm going to focus on how the changes are affecting healthcare professionals and their mental health and physical health as well. My target audience is going to be healthcare professionals who are in direct contact with COVID positive patients and healthcare systems who have a high population of COVID patients. Something to consider for these hospitals and healthcare professionals who are taking care of these COVID positive patients is that your decisions and the high stress environment caused by your fear of getting COVID, transmitting COVID to other patients, transmitting COVID to your family and your friends, puts you as a healthcare professional at increased risk for anxiety disorders, depression episodes, and just to name a few. Also, in severe cases, the stress put on healthcare professionals can result in substance abuse, such as alcohol or drugs, and some cases have even resulted in suicide, unfortunately. So I think as a community of healthcare professionals and healthcare organizations, they can't ignore this change in healthcare professionals' behavior. So multiple research and surveys have been conducted to ask healthcare professionals what resources they think would be beneficial and what they need in order to prevent the mental health disturbances that unfortunately are occurring in many healthcare professionals. Well, these surveys and research found out is that healthcare professionals are experiencing extremely high levels of anxiety. They are experiencing trouble sleeping. They are experiencing an abnormal level of fear for themselves, fear for the patients, fear of not having enough equipment to treat these patients, fear of not having the correct equipment to supply these patients. And all of this fear and anxiety and depression, it leads these healthcare workers to be more susceptible to decision fatigue and burnout syndrome. And what decision fatigue is just when a healthcare professional takes an emotional toll on themselves for having to weigh the pros and cons of treatment for a patient, and the outcome is not good. So, and unfortunately in COVID, that is happening quite often. And burnout syndrome results from when employees are under a lot of stress. They're working longer hours, they're working extra hours to make up for short staffed, or they're constantly having to pick up the extra slack, if you will, on their unit to be able to provide the best care that they know they can with the resources they're given. And what research has shown that healthcare professionals are asking for to combat these decision and compassion fatigue and even burnout, or they're asking for support groups from healthcare system. They're asking for virtual counseling, individual and group therapy. They're asking for training on how to increase their coping skills and training on how to be more resilient, because during this pandemic there is a higher need of resilience that most nurses haven't been asked to show before, so they're not, healthcare workers such as nurses aren't sure how to respond, so they're just looking for professional guidance for themselves so that they can better take care of their patients. So in this time of need, while all these healthcare workers are taking care of patients during the pandemic, I think the healthcare organization and other healthcare professionals, I think we really need to look to each other and find solutions about how we can take care of not just ourselves, but take care of our other healthcare professionals so that we can succeed in this global crisis.